the activities that you're doing promotes an imbalance, you have to keep that in mind and work on those muscles that are going to be inherently weak. Same thing occurs when you cycle. There's a tendency to be a natural imbalance, not as great as when you run, but there's a natural imbalance that occurs also when you cycle. So that understanding that being an athlete, that these imbalances are going to occur, you really have to take the initiative and have a really well thought out strengthening program.
And I think what's also important with this too is doing sports-specific strength training. You know, to go and to do bench pressing. You know, what does that do? Well, you know, increases your pec muscles. But is there anything that we really do in life, or at least in triathlon, that involves us doing, you know, a push-up maneuver? No. Yes, it increases strength, but there are better exercises, you know, that will enable us to have a stronger pull when we swim, you know, or help stabilize ourselves when we're up on the hoods of the handlebars climbing a hill out of the saddle. So you want to look at some multi-joint sports-specific exercises. And I think something else that, you know, obviously has come to light over the last few years is that core strength is everything. You know, our core strength, which is defined as the muscle grouping that starts kind of at our upper thighs, our pelvis, our abdomen, and our lower back, is really the focal point of force generation. You know, if we didn't have the core, if you didn't tighten those core muscles, you couldn't walk. You couldn't generate force. That's the wall that we're pushing against. So if you don't keep those muscles strong, then everything else has to do a bigger job, and then you'll tend to overuse that. So I would emphasize core-specific grouping of strength training, especially during the season, and core strengthening. I think that those are key elements in maintaining, you know, good body health and avoiding injuries. And again, you know, it's kind of up in the air whether or not it will increase performance, but definitely if done, you know, prior to race day, that's not a good thing to do. Allie, another question?
Yes, so one of our attendees wrote in, I recently had a sudden onset of grinding pain on the outside of my knee. What's a likely cause and what's a good solution?
Well, grinding pain, you know, I mean, that's, you know, it certainly could fall into the realm of, you know, IT band friction syndrome. But grinding, what I take home from that, and again, we obviously don't have the privilege of you know, getting a bigger history or examining that individual, but grinding often refers to what's called crepitance. Crepitance is the noise that a knee makes when load is placed on it, and it starts to make kind of a crunching, snapping sound. Now, I often will tell people that sometimes this crepitance is completely normal. If it doesn't hurt, I don't necessarily worry about it. It's often seen in a normal population of individuals. If there has been an injury and there are associated findings or symptoms like pain, like swelling, like locking sensations, then that can be something that's, you know, more significant and really needs to be taken you know, care of and sought out for, you know, a professional opinion. But obviously, you know, in any acute situation, you know, a program of icing, you know, activity modification, trying to avoid that activity, get onto a bike, see if it bothers you then, but trying to get a better characterization of when that occurs. You know, again, we're a little bit limited here in terms of, you know, how to make that diagnosis, but, you know, that description is of what's called crepitance. Now, just as an aside, if you look in, let's say it's a more senior, more mature athlete, you know, as that kneecap slides down the groove of the femur to help generate force, if there is an irregularity of that kneecap, you can get this so-called crepitance, because now you've got two irregular surfaces that are kind of rubbing up and down against one another, and that can cause those same symptoms. Symptoms associated with going up and down stairs often relates to the kneecap. But again, it could be crepitance, and I think honestly that someone should take a look at that before, you know, you go treating yourself and just kind of go, you know, on your merry old way. Allie, any other questions?
So another question, we're going to shift over to the upper body now. One of our attendees says, I had a very bad neck. I had a very bad neck and shoulder injury. I've been in physical therapy since last year. I'm not 100%, but much better than before. I do strength exercises every morning too. Any suggestions or anything I need to be aware of?
I think, obviously it's good that you're getting better. I think that a lot of these things can take time and lots of tender loving care. I think obviously warning signs would be worsening of the symptoms, progression of neurologic symptoms, radiating down the arm into the fingers, numbness, tingling. Now let me rephrase that and say to you that people who have rotator cuff problems can have those symptoms, kind of bizarre symptoms, what we call dysesthesias, which means that there's really no anatomic reason for it. No one nerve has been damaged, no one muscle has been damaged, but it's kind of this constellation of just pain and achiness that goes down the arm. But I think obviously, we always worry about red flags. Like I said, when to seek out professional help, it's when there are worsening symptoms. I think that if there's a particular motion that seems to bother that individual or there's a particular weakness, they should have someone take a look, because there could be something underlying that was not picked up at the initial diagnosis. And certainly as things become chronic, you want to make sure that you are doing the right things. So again, I would say that other than warning signs of worsening, symptoms, it sounds like they're on the right track. Again, if we're talking about, triathlon stuff, then I think, getting a swim lesson would be essential. People who tend to swim flat, who don't have good body rotation, can sustain neck injuries because they're trying to turn their head more so that they can get their face out of the water and breathe. Similarly, in the recovery stroke, you tend to have more shoulder extension, which is moving that arm back out of the way to clear it out of the water. So having someone watch you, swim would be very helpful in this, and try to correct any abnormal biomechanics that might make the shoulder or neck symptoms worse.
Great. So another one of our participants competed in a triathlon recently. And she says, I kept looking up for people who were kicking. It was my first one, and she just kept looking up to see if someone was going to kick her. So as she was looking up, I guess she strained her neck. Her neck hurt for 2 weeks after. She went to the doctors, and her doctor said it was just agitated, and it went away 2 weeks later. She wants to know how to prevent it this time. And before you touch upon the injury aspect of it, Dr. Klion, I just want to mention that the New York City Triathlon is a time trial swim start, so it's not a mass swim start, so it's not like everyone gets into the water and a cannon goes off and everyone goes. So how it works is there are going to be about 20 athletes that go into the water every 10 seconds, so that should eliminate the washing machine effect, and it should also eliminate any stress about being kicked in the face or swimming into any athletes. So I just wanted to touch upon that before Dr. Klion addresses a neck strain.
But if you're definitely a fast swimmer, there's a good chance that you're going to run up onto someone's feet, unfortunately, and get kicked. How to avoid that? Well, certainly good exercises to help prevent this and keep that neck strong would be to do some isometrics. Isometrics are a way to generate muscular force without motion. So simply by putting your hand in front of your forehead and trying to push against that hand without motion and generating some force, holding that position for about 5 seconds and maybe doing 10 repetitions of forward, putting your hand behind your head, pushing backwards for 5 seconds, putting it on the right side, pushing for 5 seconds, and pushing on the left side for 5 seconds. That will help strengthen your head and strengthen the neck muscles. That's number one. Number two would be certainly when you practice your swimming, and if you don't do much open water swimming, I would certainly do this in a pool, is that every few strokes I would practice sighting. If you need someone to help you sight, I might get one of the instructors or someone around you to help you. But again, open water swimming is a different technique in a pool. There are no lane lines. There are no ropes. You only have people around you, and objects hopefully besides buoys, maybe trees or other landmarks that you can cite, but it's that repetitive kind of looking up, coming back down, swimming a few strokes, looking back up, that can be very helpful in terms of strengthening. So it's a little bit of practice. And the other thing, too, is in the pool, is if you can find someone who's a comparable swimmer to you, is actually get used to swimming on their feet, is getting used to swimming in the bubbles. Number one, it's a great way to pick up speed. If you swim behind someone who's faster than you, you will get sucked into their eddy current, and it's actually much easier to swim. But I think it's about practicing and doing those isometrics. I think that would be really helpful in terms of preventing it. Any thoughts, Joe?
You know, that's sort of not my bailiwick, Mark.
Yeah, I think you've had some practice, you know, out in the water, other than the old ESPN commercial where there were two boats on either side hitting them with those jousting things. I think you just have to kind of practice that a little bit. But good preventative exercise, you know, in terms of those isometrics could be very helpful to this.
Great. So one of our other participants asked a question. I have suffered from jumper's knee for the past 3 months. I suspect it developed from speed work on the track and spinning class. I've had electric stimulation, ultrasound, and strengthening exercises in physical therapy for the past 2 months, but there hasn't been any significant improvement. What kind of rehabilitation program would you recommend?
So for jumper's knee for everybody, that's a patella tendinitis. Again, it's a classic overuse injury. Think of the patella tendon, which connects your kneecap to your tibia. It is part of the so-called extensor mechanism. It's part of the quadriceps mechanism that helps us straighten out our leg. It is essential for jumping. It is a huge rope that attaches two bones together. And when you exceed its tensile strength, you start to develop some microscopic tears. It gets inflamed. It causes pain, going up and down stairs, jumping, kneeling. There's a variety of symptoms that it will cause. Very hard to get rid of, but again, you talk about a program of icing, you know, an anti-inflammatory, sometimes a topical agent can be helpful. A topical anti-inflammatory like a Voltaren cream can be helpful to this. There is a strap that is called the Chopat strap. That is the one time I think that strap really works. The concept being is that is a so-called counterforce brace. If you think of the stanchions of the George Washington Bridge, if you did not have those and all you had was a cable holding the bridge up, there would be an unimaginable amount of stress and strain on those cables stopping the bridge from sagging. Those stanchions of the bridge, the uprights, deflect that stress and help suspend the bridge. The Chopat strap, in a similar fashion, as it is fashioned around your knee, around the patella tendon, deflects the stress at either end of the patella's of the tendon's insertion. For certain people, that Chopat strap can actually be very helpful. So that's certainly something that I would recommend. Injections to the patella tendon are an absolute no-no. No cortisone, no nothing at all. There are some other injections called platelet injections, the so-called PRP injections. I think there is a large body of evidence that we don't know about those injections and how efficacious they really are. I think the science is not out yet with that. So I think that's not a gamble, but I think it's something, if you are banging your head against a wall and you can't seem to get through it, that's a conceivable option. But I think from a rehab standpoint, a good physical